super excited to have you on Healthcare Strategies today. So for the first question, I wanted to start out kind of setting the scene for what public health, the role that public health has in healthcare right now. Frankly, sometimes you get the feeling that public health is sort of a separate thing from healthcare, which is very odd. And I think it would be great to just sort of hear what are the kind of big topics right now, what are people talking about in public health, and we can go from there.
Sure, it's an excellent question. It's one that I always try to explain because health as a whole, the health ecosystem is not only healthcare. People automatically default to healthcare like hospitals, doctors' offices, but when you look at the entire health system, it is inclusive of public health and a whole lot of others. So from a public health perspective, we have the health departments, the community-based agencies, federal, state, tribal, local, national, federal to the extent, and they work collaboratively with communities, with doctors' offices, with healthcare clinics, with hospitals to really amplify and promote health and safety. So in a healthcare setting, in primary care to that extent, people look at the individual and the disease, the reason why they're sick. Whereas the public health landscape looks at how to prevent people from getting sick and what are those factors that can really promote and support them from being sick, and more focused on healthy well-being, longevity of life. So with that, you find that healthcare, which tries to provide that kind of a model of care perspective versus that of the overall wellness and well-being, which is public health. They are together, but oftentimes they're separated. And with that said, the focus on public health has really been on how to really ensure that we address the behavioral and other wellness components that are significantly impacting longevity of people's lives, the ability for folks to live well-being, issues around families, maternal well-being, child health. Infectious diseases are our staple. The ability to track and stop emergent infections and prevent outbreaks. And of course, the chronic conditions that we call, such as the injuries, the motor vehicle accidents, the smoking, the cancer, and all of the above are all encapsulated. So it's a very complex, we say the big jelly bean approach to that extent.
Jelly bean?
Yes.
I love that. I mean, you touch on so many different parts of the healthcare system. It's hard to, just focus on one. But I am curious kind of what tools right now are important to the public health arena in keeping track of all of these different things. What kind of tools, what kind of strategies are key to keeping on top of these major trends?
Sure. One of the things that public health has really tried to focus on around tool development and the strategy is they have so many different pieces of data that comes in. So for example, if you are going to a doctor's office for hypertension, that information gets transmitted to the health departments, or in some cases public health, because it's important to know what are the larger population concerns. So in that respect, the ability to tap into the established medical care system, or how those data delivery points, that health data gets transmitted so that we can make informed decisions. So while a physician or a clinician may say, you know what, you are in a household, we're worried about your hypertension. If we're seeing that in a public health landscape, that there's far more individuals than there's one person in that household, that there are risk factors that can be addressed, that can be prevented, or even support mechanisms to help both improve not just a clinical response, but a more community-based, population-based response. So we look at a lot of surveillance systems that unfortunately over the course of time have become siloed. So if I am funded for diabetes, then my diabetes information stays within this database. If I'm looking at infectious diseases, they're reported in this particular system. Likewise for cancer, motor vehicle accidents, you name it. So the design that we've been really thinking about innovatively is how to get all these systems to be interoperable. How to be sure that we can not only track and trace, but support the information that is gathered for a broader perspective. So let's say we need better walkable communities, information around transportation, on design elements of the infrastructure or sidewalks. Those things are necessary to help support the data that's going to be important for us to improve community health. So a lot of it is really finding ways to connect those data points, recognizing that they all may have different ownership mechanisms, but to allow us to not just say we want all the data, but enough to give a robust and complete picture to make better health decisions.
Yeah, I was going to ask, I mean, that covers so much from transportation to disease states. How do you determine what the important data is to watch?
Yeah, it's difficult because there's so much. So for example, on the infectious disease, you're tracking anywhere from 70 to 80 different diseases on a daily basis. Now on the chronic conditions, there are far more, right? And they have different rules, different authorities as to what should be reported and how you should mechanism. So when you think about public health, we're not monolithic.
Yeah.
We have areas that are specifically on chronic diseases, areas on infectious diseases, areas that are on social mobility to that extent. So the avenue towards prioritization is looking at what are the prevailing trends that are really a concern for health and safety and wellness, and how can we do our job to be able to support it and bring the tools that are innovative, the technologies that are supportive and help reduce disparity, while at the same time being a little bit more effective in how we provide intervention strategies, programs, and evaluate the success of them over the course of time.
Yeah. And what kind of tools are you really using? I mean, is it different for each of those issues?
Yeah.
Okay.
It depends. So a lot of the data and analytics looks at race, ethnicity data, specific disease data, over the course, longevity with respect to geolocation, so where individuals live, because we also have the saying, your zip code oftentimes denotes your livelihood and how long you will survive, or how long you will live, and your life course to that extent. So data elements that are able to not only look at geographic, but also the specific health-related factors. Are there conditions, as we call social terms of health, that have a significant impact on how you will be more prone for being exposed to a particular disease or having a certain health condition? All of these things are going to be important. So the data tools that we use not only look at, we call them surveillance elements, but also secondary and other forms of data that help complement the larger picture.
One of the things that you brought up a couple times here, and it comes up in pretty much every conversation that we have here at HIMSS, is data. And healthcare, all these healthcare organizations generate so much data as it is about each individual patient. But then public health, as you're mentioning, has all of these overlays of data that are both essential or critical to understanding the community health, but also I could see them adding a bit of complexity to what we're looking at, just the wealth of data, the volume of it. How do you go about public health data integration in a way that is both comprehensive, but also effective and meaningful?
There are a lot of, strategies that are currently underway. One, for example, is TUFCA, which is a support between the Office of National Coordinator, which tries to pull the data that comes from, let's say, the private entities, the healthcare side of the coin. And that really is important because you as an individual may have, for example, a wearable device. Do you count your steps? But there's no mechanism to ensure that that information can then be fed into a larger cauldron, or database that allows anyone who's trying to make decisions around, let's say, physical activity, nutrition. What are the activities, what are the factors that will be helpful, not only to you as an individual, but maybe to your family, maybe to the community as a whole. So the design of a lot of these particular frameworks are an effort to connect all these various pots of data that exist. So your wearable device data, how can that preserve your privacy to ensure that there's that confidentiality and that security, while at the same time enriching the understanding as to how individuals work, live, play, and the impact that has on their health, and what are those strategies or those interventions that can then come in and help either elevate that or support it where there is a concern. So when you think of the role of healthcare and your description that you mentioned, a lot of these entities have what they call population health metrics, meaning it's their population of patients. Whereas public health looks at the entire community. So the value add is how can public health, through the partnerships with the public and private entities, really tap into that information in a way that preserves the privacy of the sole individual, while at the same time enriching the amount of data that's there for decision making. So it's one thing to say, I know how many people may have had a motor vehicle accident within this zip code. But what are the elements that can now change the dynamic to improve and reduce that number of casualties or morbidity, as we would say, to really be impactful? And that's the design of it all.
You know, a lot of this depends on strong collaboration between a lot of different areas of the healthcare industry. That's challenging in every aspect of healthcare right now. How would you advise organizations that are looking to partner with public health organizations like yours? How would you advise that they go about that partnership in a way that is effective?
A sense of ownership. Ownership in the part we play for the broader community, the broader health, right? While everyone has their particular reason for being, right? You may have a clinical center that's their main focus is on cardiac care. And they want to really provide that supportive mechanism for individuals who are suffering from heart disease. Whereas another may just want to focus on hypertension or, for example, diabetes. The avenue of the sense of ownership in each of those particular buckets to that broader community strength is one where I think a private organization, a semi-public organization, the whole value of that public-private partnership comes together. The governmental agencies, even down to the community-based groups and organizations such as towns, villages, counties, cities, all of that has a value sense of ownership that shows that you are playing your part to the broader mission of improving a safer and healthier world.
Well, amen to that. Hope we can get there. Thank you so much for coming on today, and it was great to talk to you.
Thank you.